Women, we are not the best about getting help for our bodies when we need them. In fact, we usually wait until multiple systems are involved to go to the doctor and start asking for help. Today, we are going to discuss the common symptoms that bring women into my clinic with pelvic floor dysfunction. I'm going to list them in order of most common to least common, so stick around to the end because I'm pretty sure that the last one's going to surprise you. All right, the first thing that will usually bring people running into my clinic is when they have pain inserting a tampon or pain with intimacy. Now, many times women will tell me that they've had pain with inserting a tampon for years. However, they just stopped wearing tampons and used another form in order to avoid that pain. But it's when it becomes pain with intimacy that they're coming in my door because they want help for this issue, which is completely understandable. However, if you've been having pain with inserting a tampon for years, it's going to take longer to deal with. And chances are good that more systems have gotten involved. So it's really important to make sure that you get a complete evaluation of not just your pelvic floor, but your hips, your SI joint, and your low back to see how your body has compensated for this pain over time. Which leads to the second most common thing that brings women into my clinic is any form of sexual dysfunction. And that can be pain with insertion, but can also be difficulty achieving an orgasm. Many women don't know that that can happen over time as we age because of a pelvic floor problem. So they've struggled with the common symptoms of pelvic floor dysfunction for years, but it never got to the point of actually impeding what they wanted to do in life or the enjoyment they wanted to have in life, so they didn't necessarily get treatment for it early on. But now it's gotten to the point that it's impeding intimacy and making that difficult or challenging or frustrating, making them not want to be intimate with their partners, which can significantly affect your relationship. The third most common cause of pelvic floor dysfunction that brings women into my clinic is a feeling of heaviness in the pelvis. Now, if you've ever been pregnant, you're kind of used to that feeling of heaviness. As you get bigger and the baby starts to descend, you just feel like I'm literally carrying that baby around in my pelvis. So yes, it's normal when you're pregnant. However, it's not normal when you're not pregnant. So if you feel like there's this heaviness in your pelvis, it's probably because your pelvic floor muscles have gotten really tight and very sensitive, and you're getting some organ disruption, which is causing that sensation of heaviness in your pelvis. For you, it's important to make sure that you're working with a pelvic floor specialist who can also work with your organs and do some organ massage to make sure that everything gets back in the right place. The fourth most common sign that brings women into my clinic is actually urinary incontinence. So this typically starts as difficulty urinating when you laugh, cough, or sneeze, and it may have gotten to the point where it's difficult to make it to the bathroom. Now, this is the fourth most common sign because women definitely tend to put this off. It starts with the laughing, coughing, sneezing, and then they think, it's not that big of a deal. Everybody has it. It's normal because so many people do have it. And I do understand that many people do think it's normal because so many women have it. But just because so many women have a dysfunction, that does not mean it's normal. It means our medical system is not adequately addressing this and helping women find solutions early on before it affects multiple systems. Okay. I'll get off my soapbox now. But it's the fourth most common thing that brings women into my clinic. So that means that a lot of women do consider it normal, but I'm here to tell you it is not normal. And the sooner you get help for it when it first becomes a problem, the easier it is to heal. As a women's health specialist, it is really frustrating to me to see women come into my clinic in their 40s, 50s, and 60s and require an extensive amount of treatment that if they had gotten it in their 30s would have been very easy to fix up. And it's lovely to see more women coming in who are in their 30s, who have had children, who have been referred to by their OBGYN because the OBGYN says it's not normal to pee when you laugh, cough, or sneeze, or run, or jump, or anything like that. So I'm super excited to see that this tide is turning. However, there's this older generation of women who did not have that information when they were young. And now there's multiple systems involved, and it's taking taking longer to heal, and they're really frustrated that they didn't get help earlier. So if that sounds like you, I want to encourage you, there is still hope for you. We can still fix your pelvic floor dysfunction. It will take longer than it did when it first started, but I promise you there are still things that can be done to help you too. And the fifth most common sign goes along with that, and that is fecal incontinence. Now, women definitely don't want to talk about this. Nobody wants to talk about this, but it is a problem when you can't hold things in or when things come out when you're farting. This is not normal if it happens regularly. Now, I understand you may have eaten something a little bit different and things happen a little bit. You know, food affects your digestive system, and I understand that. It happens once or twice because you ate something that maybe you know you shouldn't have. I'm not super concerned about that if you can state the symptom that caused it, and usually it's a food trigger that will cause that. However, if it is happening regularly and it doesn't seem to matter what you're eating, then this is definitely a pelvic floor dysfunction, and you want to get it taken care of as quickly as possible, because this is definitely a difficult one to be struggling with. On the opposite side of that spectrum is reason number 6 that brings women into my clinic, and that is constipation. Now, I will say that many women who come into my clinic do not come in for constipation. They are actually struggling with one of the other issues, and it's only when we start talking about their pelvic floor dysfunction and their symptoms that they've had over the years that we start to discuss constipation. And they're like, oh, I have tried everything for that. I have changed my diet, I've drank more water, I've taken fiber, I've taken over-the-counter medication. They've done all of these things to deal with their constipation and it hasn't resolved. Well, friends, if you've done everything else and it hasn't resolved, chances are good that it's due to pelvic floor dysfunction. So if you happen to be one of those people who is suffering with constipation and you have already done everything else and you're at your wit's end of what to do about it, I'm going to encourage you to seek help from a pelvic floor specialist who can look at your entire body along with your pelvic floor and make sure that you're getting the treatment that's designed for you. Alrighty, ladies, there it is, my top 6 reasons that people come into my clinic with pelvic floor dysfunction. Which one did you find the most surprising? Drop a comment below and let us know. If you like this video, give it a thumbs up. And if you'd like to learn more about pelvic floor dysfunction, I'm going to recommend you download my free webinar where we discuss all of this and way more.